Good morning. My name is Bruce Stevenson. I'm that guy on the left, and I have been a dentist in San Leandro for about 37 years now. And my able assistant Terry, standing next to me, and I now pretty much limit our practice to Invisalign, clear braces, and related cosmetic procedures. And so what I'm going to talk about today is Invisalign primarily, but some other options as well. I'm going to show you how Invisalign moves teeth. I'm going to show you some cases that are fairly interesting, I think. Kind of give you a sense of what the possibilities are with Invisalign, as well as talk about some of the things you need to know if you're considering doing Invisalign. So move right along. Terry and I not only are the award-winning Bay Area Invisalign team. We've won more awards than anybody else in the Bay Area, but we are also Invisalign elite providers, which means we do more Invisalign cases than almost anybody else in the area, more than 99% of all the dentists in the United States. Some people have been told that Invisalign just won't work for them. It's impossible. And I'm here to tell you that in many of those cases, Invisalign will work quite nicely. And we'll show you some of those cases as we go along. So don't be too discouraged if even more than one dentist has told you that Invisalign won't work for you. In many cases, using the more modern Invisalign techniques, it may work just fine. Invisalign is a brand name for a variety of different devices and different brands of things called clear aligners or clear braces. And as I say, there are several different brands out there. And we use some of these other brands occasionally if we think they might be advantageous. Invisalign, however, has some very nice advantages. The material that Invisalign uses to make the aligners, it's better. It is more resilient and it just works better for moving teeth. And of course, Invisalign has patented this. Some people refer to the bands on the left as clear braces. And as a matter of fact, the brackets that are on the teeth actually are fairly clear. And you can even put in the wire that's coated so it's white. But that's not what we're talking about. We're talking about removable aligners. And again, Invisalign is a type, it's a brand, a removable clear aligner, like you see on the right-hand side. There's certainly lots of different ways to move teeth. There's an example of the clear brackets and that white wire in there. And again, that's not what we're talking about when we talk about clear braces. There's also a variety of ways to move teeth with removable appliances besides Invisalign. The Inman aligner, which we also use occasionally, is not very invisible and will work in some situations. But what we're talking about today really is brand name Invisalign. And Invisalign moves teeth by using a series of these aligners. You put in a new set, an upper and lower aligner, typically every 2 weeks. And each set of aligners, and we'll show you in just a minute, very gently moves the teeth, kind of nudging them in to the new position. So after wearing a series of these sets of aligners, we've got the teeth where we want them. So there's a clear aligner. The advantages of clear aligners, and specifically the advantages of Invisalign, are that they're comfortable. You know, we don't have metal in your mouth. We don't tighten the metal all at once. That's really traditionally is what causes the pain with fixed conventional metal braces. So they're comfortable. You put in a new set every 2 weeks. It's going to gently move those teeth. They're pretty much invisible. From a speaking distance, you really can't tell that somebody is wearing the aligners. And the advantage, and also a disadvantage, is they're removable. You can take them out. You can eat anything that you want. You can brush and floss as you usually do, which you can't do with conventional metal braces. However, it's also a disadvantage because you've got to remember to put them back in. And we'll talk about that towards the end of the presentation. So here's a guy He's got some crowded teeth and not very happy with the way his smile looked. And as a matter of fact, one of the things he complained about was that he never smiled. So let's see what's going to happen with Invisalign when we move those teeth. Here's a little movie. Each one of those little jumps is a new set of aligners. So we slowly move those teeth into the new position where we want them. Another view showing those lower front teeth. He didn't, even though he had crowding, he didn't have too many teeth. He just had the teeth in the wrong position. So by moving those teeth out where they belong, we then have room for all of them without them being crowded at all. Here's his upper teeth, same patient. See that one front tooth on the left-hand side, how far that had to move. So, what do you look at like when he got done? Big improvement. Now, he bleached his teeth, and we do give you the bleaching solution to wear in the Invisalign aligners as he went along. But the other thing you notice is look how much more he's smiling now, and he smiles a whole lot more. Wouldn't you? There's the before and after. So here's another case, not quite as dramatic, but again, some crowding in there that we're going to correct. And look at the chipping and the discoloration on the edge of those front teeth. That's something that Invisalign is not going to fix, but we're going to fix when we get all done with just a little bit of very conservative bonding on there. No removing any tooth, no shots, very conservative way to do it, because that's something that Invisalign can't grow new teeth. It can put the teeth in the proper position, but chips and discoloration are not going to go away with Invisalign treatment. So there we are removing the teeth. Notice that one tooth is moving up. We can move those teeth, not only correct crowding, but move the teeth in various directions. Here's our lower front teeth. A lot of people have crowded lower front teeth. Invisalign works very well for that. Again, not too many teeth, just teeth in the wrong position. There's her after. Now look at the edges of those two front teeth. We did just a little bit of very conservative bonding and corrected those edges. She also whitened her teeth during the Invisalign treatment. There's the before and after. Really happy with the results. You can see the difference, just straightening those teeth and making them a little bit whiter and doing a little bit of very conservative bonding. Here's spaces. Now again, notice the chips in those front teeth. We're going to fix those when we get done. Invisalign loves spaces. Here we are. We're going to close those spaces up. Again, remember each one of the little jumps is a new set of aligners, typically about 2 weeks between jumps. Here's our after. We did a little bit of very conservative bonding to fix those chips. Patient also bleached his teeth. Pretty nice before and after. Here's a more dramatic case. If you look at those upper front teeth, they're behind or inside the lower front teeth. This is called a crossbite and can happen both in the front teeth in this case and also in the back teeth. This is a little bit more complicated to treat, takes a little bit longer, but very doable with Invisalign. And as a matter of fact, Invisalign probably works better than conventional braces for correcting crossbites like this. See how the teeth slowly move? We're moving those lower front teeth down, and then we move those upper front teeth out over the lower front teeth where they belong. No bonding. Patient did whiten his teeth, and he was very pleased with the result. Pretty dramatic before and after. Invisalign really works. So, that impossible? No. He was told by 3 different dentists that Invisalign would not work for him. It's not impossible. He just needed to get a fourth opinion, and he did, and it worked. So, what do you need to understand about Invisalign? Really four things. Two major things and two minor things. The major things, first of all, the aligners need to be worn 22 hours a day. You take them out just when you eat, brush, and floss, but the rest of the time they need to be in there so they can move those teeth. If you wear the aligners 11 hours a day instead of 22 hours a day, the teeth don't move half as fast. The teeth don't move at all. So we need 22 hours a day of aligner wear. It's a commitment. And you're talking about typically from 6 to 12 months, sometimes faster, sometimes a little bit longer. But it's a commitment to wear those little rascals 22 hours a day. Now again, the advantage is they're comfortable, they're pretty much invisible, and they are removable so you can eat anything that you want. When you get the teeth nice and straight where we want them, you need to retain them there. You need to wear some retainers at least a few nights a week forever. And this has nothing to do really with Invisalign or orthodontics. This has to do with the fact that teeth always move over time. So if your teeth are perfect right now, Mother Nature just gave you perfectly aligned teeth, you probably should start wearing retainers, because I can pretty much guarantee you that 10 years from now, those teeth will probably be crowded. So something to think about. In any event, after you do Invisalign, you get the teeth where you want them. Definitely want to wear some retainers at least a few nights a week forever. And we do provide the initial retainers for you. But that's just maintenance going down the road. Those are the two major things, 22 hours a day and retention afterwards. A couple minor things that we want people to know about is we bond some lumps of tooth-colored material on the sides of some of the teeth, and these are called attachments, that help the aligners get a grip on the teeth so that we can move them. We take these off once we get the teeth where we want them, so you don't wear them when you're wearing the retainers. These don't hurt you, they don't hurt the teeth, just something to know about. And the last thing is, we often will polish a little bit in between the teeth, and we do remove a little bit of the tooth, but it doesn't harm the tooth and it doesn't cause cavities. This allows the teeth to move a little bit more easily, so we get a better result. Those two things, the lumps on the sides of the teeth and the polishing between the teeth, are minor considerations. The major considerations are 22 hours a day of aligner wear and then retention afterwards. So how long does Invisalign last? That's a very good question. Porcelain veneers that you see there on the upper right are sort of an alternative for making teeth look better. The problem with porcelain veneers is you have to remove some tooth structure, often a substantial amount of tooth structure. So those teeth will always be different and will always require something on the teeth. The porcelain veneers typically last 10 to 15 years and have to be replaced. So porcelain veneers are not permanent. Kind of like your car. You drive your car long enough, it's going to wear out, and you're going to have to buy a new car. How about your house? Well, your house may fall down someday, hopefully not while you're in it, and you may have to buy a new house. This is a big advantage of Invisalign. If you wear your retainers, underline that, you need to wear your retainers. But if you wear your retainers, your teeth will be straight the rest of your life. Your perfect smile will last you a lifetime, unlike even your house. So hopefully we've given you a little information about Invisalign and how it works. If you're interested, if we can help you, you can see the telephone number on the screen and the website on the screen. The consultation is free, and Terry and I would just be delighted to talk to you.